All right, and welcome to the next episode of the Info Diet Podcast. I'm the host, Michael Gimmerin. Today, I'm joined by Dr. Phil Ovadia, who is a cardiac surgeon and all-around metabolic health expert. Dr. Phil and I met a few years ago, and he has been an incredible resource for me in my own information environment in terms of his healthcare knowledge, understanding, and background. So I thought it would be interesting today to talk to him about his experience. Dr. Phil, anything that you want to add by way of introduction? And this might be where you plug sort of what you're working on.
Sure thing. It's just great to be here with you again. Good to talk with you again, Michael. As you said, I am a cardiac surgeon. I've been a cardiac surgeon, a heart surgeon now for 20 years. And during much of that time, I struggled around my health. And as we're going to get into, a lot of that was due to the information that I was consuming. And when I changed some things about the information that I was consuming, it helped me improve my health. And then it ultimately helped me better help to improve the health of my patients. And so, I am increasingly focused now on preventative health efforts and helping people to stay healthy and to stay off my operating table, which is the name of my book and the name of my podcast. And that would be a great place for people to start following me.
Awesome. Thank you, Dr. Phil. I guess what the best place to start would be, you're a doctor, you're a cardiac surgeon, and then you were unhealthy. Like, what's going on? Were you just not following the standard advice?
I would say I was very much following the standard advice, and that really started, going back to childhood. I mean, when I think back to, the foods that my family consumed, they were very much in within the U.S. dietary guidelines. I had an older brother who was a type 1 diabetic. So we were, consumed very little sugar in the house, and we did all the low fat, skim milk and margarine instead of butter. And I was also very active, throughout my childhood and throughout my life, really. I've always been pretty active and played sports and stuff like that. So despite, following the advice, and then, going through medical school, going through the training to become a heart surgeon and practicing heart surgery for over a decade, I was becoming progressively more unhealthy during all of that time. And I, followed the advice. I tried the advice and it failed me. And quite honestly, although I didn't quite recognize it at the time, because I think of, the environment that I was in and the information environment that I was in, it was failing my patients over and over. And it's only when I started to, seek out different answers for myself that I was then able to seek out the different answers for my patients.
I have a couple of follow-up questions, if I may. You're a very technical specialist, right? You're a heart surgeon, so you have an understanding of healthcare metrics that maybe a lot of us didn't have. And if you're okay telling us, like you said, you were very active, you had low-fat diet, all these things, but then you mentioned that your health was bad. How did that manifest for you? If you're okay with telling, was it a specific number that you look at as a cardiac surgeon, or was it that you were getting winded going upstairs, or maybe you were gaining weight and you kept trying to diet or this kind of thing and it wasn't working? I mean, I think it's really important because generally, Dr. Phil's story, your story is very similar, right? Where you have a pattern of behavior and then something happens. They call it a red pill moment on some areas of the internet, but basically something happens where you're like, you know what, this isn't working for me. And so you go and you look outside of the normal, and then that process of discovery leads to a transformation. And I think for a lot of people in health, I want to know what that is. And I want to know what that is for you, because if there's anybody who should know about what healthy is, it's a cardiac surgeon.
Yeah, no, you would certainly think so. And for me, the most obvious manifestation of my poor health was my obesity. But honestly, that was something that didn't particularly bother me. I had been overweight, since childhood, and I had just kind of come to accept it. Basically my entire family's overweight. And, so that didn't bother me as much as it should have, because, being overweight is a clear indication of being unhealthy. While it's technically possible to be healthy while overweight, most overweight people are not healthy. And then there were, some of the other indicators for me. There was the, lack of energy, the tiredness, the needing, multiple cups of coffee to make it through my day, or falling asleep in my office, in the middle of the afternoon, after I had finished operating, those types of things. And honestly, none of them really woke me up, because I think I was so used to being around sick people, being in the hospital all day, and all my patients, obviously were pretty sick, coming to heart surgery. And so on some level, I would say, well, I'm not as bad as them. So, I guess I'm doing okay.
You were in the pipeline to be on your own operating table.
Oh, certainly. And, in retrospect, I recognize that. And then I had the wake up call. But, at the time, there are lots of unhealthy doctors. It wasn't even like,
right.
I would be in the doctor's, the doctor's lounge, and, I was the only, obese one. Obesity is as prevalent amongst medical professionals as it is in the general public.
See, and that's crazy to me.
Yeah.
I think if I go to a hospital and I get a nurse who's obese, and then she's telling me about my own health, it doesn't track for me. It's like going to a dentist with bad teeth. And I'm sorry that you were doing that for 10 years, but like, it's crazy. And anyway, sorry for that.
Yeah, no, I mean, it is crazy to me now. But it certainly wasn't then. And it wasn't, it wasn't like my colleagues were all around me saying, look at the path you're headed down, and what are you doing? I would go to my family doctor every year for the, standard checkup like everyone else. And they would just say, oh, doing fine. Everything looks okay. Yeah, you need to lose some weight, but, and that's really the information environment around healthcare these days. What people, I think, need to understand, and what I have certainly come to understand, is the healthcare system has evolved to take care of sick people. It has not evolved, and it is not focused on keeping people healthy. And it's just the reality. And, I don't blame the individual doctors, because doctors are all trained within this system. We all hear the same stuff in medical school, essentially. No matter what medical school you go to, the curriculum's largely the same. And, you get out into practice, and there are practice standards, and there are the guidelines, and all these things that, kind of keep physicians within a pretty narrow mindset overall. And it's, pretty hard to get out of that. When I finally did, as you said, had my red pill moment, and I kind of woke up and looked around me and said, what have we been doing? What have I been doing as a physician, and being so unhealthy, and then, trying to guide my patients. And, you just realize that the whole system is built around sick people, and it's not built around keeping people healthy. And so, that has been a very, that was another part of my red pill, I guess you could say. My red pill first started with, I have to do different things. I have to get different information in order to improve my own health. And then, the second part of the red pill was really how the healthcare system is broken, and, what can I do to, help to change that?
Yeah, let's look at the first before the second. So, when you woke up, so this happens to a lot of us, right? And we maybe wake up in one area of our life, and now all of a sudden we see it in all these other areas. So was your process that you said, okay, I have bad health, right? I'm obese. I need to change the outcomes. I need to no longer be obese. And so I need to look for people that are no longer obese and listen to them in telling me what I should do? Or how did that process look for you? Like, were you focused on outcomes? Were you like, okay, what's a better process? I mean, like, what was the driving idea?
Yeah, so really, to be honest, it was more, I would guess I'd have to say I sort of had the red pill, shoved down my throat in a lot of ways, and it really came in two separate doses. So for me, it started, my wife was having some issues, and she had gone and seen a health practitioner. And they had suggested, a course of action to her that, quite frankly, sounded a little crazy to me in my, standard medical mindset. But I was a supportive husband, and I said, "Oh, okay, let's do it together." It was some dietary changes, going gluten free,
Mm-hmm.
so I said, "Okay, I'll do it with you." And I noticed some improvement in the way I felt. And I started to lose.
Which is interesting because you weren't the one who was given the advice, but you were doing
Right.
it like as like a solidarity thing. And you're like, wait a minute, this is making me feel better.
Exactly. And, I started to feel better. I started to lose some weight. And that kind of didn't make sense to me because, what I knew about gluten free diets is that they were good for people with celiac disease. I didn't have celiac disease. So why do I feel better, on this diet? And, that didn't fully get me, that was sort of the first nudge. And then the second nudge came a few months later when I was at a medical conference, and the guest lecturer at the conference happened to be Gary Taubes, who's a scientific journalist. At that time, he had just written the book, The Case Against Sugar. And, you can kind of picture it. I'm in the big lecture hall with 1,000 other physicians, and here's some journalist talking, and I'm kind of sitting there like, why is there some journalist talking to this group of heart
Yeah, he
surgeons?
doesn't even have a white coat.
Yep, exactly. And but he started talking, and what he talked about made a lot of sense to me. And it was like it just clicked. Like he talked about why we get obese, and it's the type of foods more than the amount of food, and the types of food influence the amount of food, and all these concepts that were scientific, but I hadn't heard them in medical school. I hadn't learned them, in my, decade plus career as a heart surgeon, but it made a lot of sense. And so, I immediately started consuming, more information around that concept. I read Gary's books, and then I, started looking into other,
Yeah.
started going through some of the literature, and, was able to, connect with some other people who thought the same ways. And, I tried it, obviously, and it worked. So that was
Right,
something.
right. You had like a snowball.
Yep. Yep. And then I, talked to, and then some people saw all the weight that I lost, and, how much, more energy I had. And they said, "What are you doing?" And I said, "Well, I'm doing this thing, I don't really, and they tried it, and I saw it work for, a number of them. And then it just kept reinforcing it. And with that, I really, I had my eyes opened to, you know, how, because I asked the question, why didn't I learn this in medical school? Why hadn't?
Wait. We'll get to that in just a second,
Yeah.
but I want to get to I think, so your wife's experience and your experience of being in solidarity, that changed for you. And from that point on, you had a more open or a growth mindset on the topic, right? Because this was something you didn't anticipate with celiac disease and being gluten free. And so, because I have a hard time believing that going to this lecture about the guy talking about sugar was the first time that you had heard, right? We've known, like, for example, the lipid hypothesis has been false for like 70 years, and yet everybody repeats all the stuff on statins and all this thing. You could probably tell me way more than I do. But my point is that that was in your information environment. And I think it's that willingness to be open to new information that's the key point. And what I'm trying to get at in your story is, where did that start? Was it literally going gluten-free for a month, and then you're like, 3 months later, okay, I'm here, I'm open to try new things because I did this other thing? And
Well, I do think that opened the door, because I have kind of pondered, if I didn't if my wife didn't come home and, talk about going gluten-free first, and I was just at that conference and heard Gary talk, would it have gotten through to me? I don't know that I would have been open to that information, because it is so counter, what we hear in medicine. And you kind of made the quip that, oh, we've known the lipid hypothesis, has been false for 70 years. But the reality is that in the healthcare system, we don't know that. The lipid hypothesis is very much held to be truth. And it's all I ever heard. I graduated medical school in 1998. By that time, statins were the most widely prescribed class of medication, and have remained so. And I never heard anything else besides the lipid hypothesis to explain why heart disease occurs.
But
and I never heard in medical school, anything besides obesity occurs because, calories in is more than calories out. That was the explanation. That was accepted as truth. And it was, only when I heard Gary talk, that was truly the first time I could say that I heard a different hypothesis around obesity.
Yeah, it's just crazy to me because it's not like there haven't been studies on the lipid hypothesis.
Oh, yeah.
And it is so, and this is why I have a huge amount of empathy, and I think you do too, for all your colleagues in medicine, right? Who are every single place that they turn, whether it's the New England Journal of Medicine or their medical school, or I assume there's continuing education or periodic updates for various things that doctors are required to go through. They have these systems of information that are reinforced. And so why should they? And I would probably, it's probably true that for acute medicine, 95% of what they're taught in medical school is the absolute right thing, right? It's like if somebody's bleeding, this is how you treat them and you go through these steps. Or if somebody shows these symptoms, this is how you diagnose it for a disease. And so why should they have an idea that, hey, maybe there's information that's out there that contradicts or at least calls into question these things? And they're like, oh, I don't really have time for this because I'm too busy seeing patients every 6 minutes or something like that. I think not enough is celebrated when doctors like yourself have the courage to, and I understand that you'll say something like, well, it was because I was just, being a good husband, but have the courage to just be open to the idea that there is other information out there. Because, like, correct me if I'm wrong, but there's now data that shows that statins do nothing, right? Like, they're basically totally useless. And
Yeah,
like you said, it's still the standard of care.
Exactly, and their benefits are greatly overstated and their negative effects are greatly understated. And largely the same could be true for, most medical treatments, to be honest. So it becomes an interesting challenge, within healthcare, because, you can, as you said, the studies are out there, and almost any issue you look at, there are studies, on both sides of the issue. I mean, that's the nature of science.
Right.
And so it becomes a very interesting challenge for, physicians, for healthcare professionals to start to decipher that information environment. And it is very much, what gets told to us, what gets taught to us, it is very much controlled. And like I said, pretty much no matter what medical school you go to, you're going to get, the same curriculum. And, the board exam, for instance, that, every physician, needs to pass within their specialty. It's testing the same information, everyone needs to know the same information.
Right. And then you could say, across the country, we have a standard uniform of care. Yep. And one doctor can jump in an emergency situation on a plane or whatever. I get that. So, okay, you just said something that I think is very interesting for people. As a lay person, I read the news, okay? And I feel like when it comes to different foods, whether it's eggs or whatever, this decade we say this decade we say that. It feels very flip-floppy, and it looks a lot like California politics, where one special interest group passes a law, and then 6 months later, another opposing special interest group gets the law revoked, right? And they just sort of ping-pong back and forth. And you just mentioned that there's studies on both sides. and I'm not a heart surgeon, I don't have the background in statistics to read it, what do you do to make sense of the studies that are on each side? Like, do you have any rules for yourself? And then where I'm going with this is like, what advice do you have for people who are trying to get medical advice because they want to go to their doctor, but you just said that most doctors are in a system that provides them this advice. And even though we've known that the standard of care for that's related to the lipid hypothesis has been false for 70 years, it's still the standard of care. So what are they supposed to do? Like, how do they evaluate it? And we'll start there. How do you evaluate it? And then what advice do you have for people?
Yeah, so ultimately I try as much as possible to fall back on, kind of real outcomes that I can find, that I can point to in these studies. We have to realize that the vast majority of studies that are done are really garbage. They don't have, hard outcome measures. They're not looking at, whether people live or die, for instance, because in order to really study whether something has an effect on people living and dying, you have to look at vast number of patients over many, long time frames. And it's just, the science doesn't get done that way. So it's often looking at, softer endpoints, surrogate endpoints. And that should be a little bit of a red flag, if you're looking at a particular study.
Does that apply to, sorry to interrupt, does that apply to correlations as well? So a lot of times you'll have a study and they'll say this such and such eating blueberries is correlated with blah, blah, blah
Right.
outcome. Right. And then you're like, well, what the hell does that mean?
Yeah, exactly. That should be a major red flag. And when you really pay attention to the news reporting a lot of these studies, that's how they'll report it, because that's what the study showed, that it's correlated. And correlation does not equal causation. It's one of the most,
Are you kidding me? My grandmother, when she heard about that red wine study, she went out and she drank red wine every night, right?
Yep. Yep.
And now, of course, they've
and then a couple of months later, she had to stop, right? Because the next red wine study came out.
Well,
And so,
for everyone listening at home, because I'm kind of a nut about this kind of thing, they did a study. They updated that study, but they controlled for wealth. And it turns out that the reason why red wine was better is because on the whole, richer people had it. But when you take out socioeconomic status from the study, there's no benefit to drinking any alcohol, which of course you could probably tell me, any doctor would tell you, but like, that's what I thought was the most amazing thing, was that the red wine was only good because that was the drink that rich people used and lived longer.
And the red wine story is actually, very interesting, because, there was a mechanistic explanation for it. There was a particular chemical in the wine that, it had been shown, to improve longevity and everything, resveratrol. But it turns out, like, the amount of red wine you would need to drink to get, adequate doses of resveratrol is something like, on the order of barrels a year, of red wine. So it just, things can make sense. And this is something else, that I go back to, that, as much sense as something may make, as good as it sounds, you eat fat, you get fat. Sounds perfectly logical. Of course that makes sense. We don't even have to prove it. It makes perfect sense. But unless you can actually prove it, it's not true, when it comes to science and when it comes to medicine. And so, you have to be very careful about that. And I guess, what I try and do now is, if the less data that's behind, when people just say, oh, we just know it's true, that is a major red flag to me, because oftentimes they're saying we know it's true because someone else said it's true, and there was never any proof of it in the first place. And I know there's a kind of saying around that it's basically much easier for lies to spread than the truth to spread. And unfortunately, the same. It's no different in medicine.
Yeah. Well, I mean, so I really like that one, right? Which is basically a restatement of, if it sounds too good to be true, it probably is. And, trust in God, all others bring data, right? In God we trust, everyone else bring data, I think is the other thing, which is if someone says something, you're like, okay, great. That's a pretty bold claim. Let's see the bold data that supports that claim, right? Let's balance the magnitude of the evidence with the magnitude of the claim. I like that as well.
Yeah, exactly. You know, the only problem with that is you may have heard the old joke about, you know, what's the difference between God and a cardiac surgeon? God doesn't think he's a cardiac surgeon.
Yeah, exactly. Well,
Yeah,
that's why it's such, honestly, that's why I think it's such a breath. It's so cathartic to be speaking to you as a cardiac surgeon, because in the pantheon of like doctors who have God complexes, you know, cardiac surgeons are right there at the top, right? Like it's like brain surgeon and then like cardiac surgeon. And so then you're just basically like, you know, I woke up one day and realized I'm not healthy. And then you went on this crazy journey, and you should follow Dr. Phil and you should read his book, Stay Off My Operating Table, because you'll learn more about it. And then now basically you've pivoted your entire life around this idea of we want to combat medical misinformation, right? And to your point, it's not that people are being disingenuous or that they have an agenda against health, right? So it's not the practitioner's fault. It's that the system is set up so that repeating the misinformation is so much easier than going back and saying, you know, we've had this belief for forever. Maybe we should reevaluate it, right? And of course, because for so many things, there's cost associated, and the studies are now so expensive because of the way they have to be done, that not a lot of those things that we sort of take for granted that we discovered in the 30s, 40s, and 50s, no one really ever goes back and looks at them, to the detriment of all of us.
Yeah, I think you know, that's certainly a problem we have, that a lot of what we knew we have forgotten, and we have forgotten that we forgot it. Because, you know, most of these debates, you know, my focus ends up being a lot around nutrition and what we eat. And, you know, most of these debates around what we eat, it turns out that we had a lot of the answers, you know, 100, 200 years ago. And in fact, we didn't even have to ask a question, you know, 200 years ago, because we didn't have the same you know, food environment. And you know, in a lot of ways, I guess that sort of relates to our information environment. You know, the food environment largely 200 years ago was whatever grew in your local community, and you know, whatever you had access to. And people were, you know, generally didn't have a lot of the problems that we had now on a health standpoint. Now, there were other problems that may have come with that, but you know, we've now created this food environment that has created this whole, you know, health environment that goes with it, that has not been beneficial largely. And now we're trying to figure out how to undo all of this damage. And the real answer is, you know, we largely just need to get back to what we used to know, which was just eat real food. It really, you know, kind of comes down to that. And yet we spend all this time arguing about, you know, the fat and the sugar and the, you know, the cholesterol, and, you know, eggs are good, eggs are bad. And, you know, to some degree you have to.
Is it this week?
Yeah, exactly. And so, you know, largely what I now kind of talk to people about is kind of zooming back out and just saying, you know, what did we do for the vast majority of our existence as human beings? What did we then do to screw that up? And, you know, let's go back to what we were doing in the first place.
Yes, especially because we have 100 years worth of data that shows that we've gotten worse, right? So you're like, okay, if my great grandmother would not recognize it, I'm not going to eat it.
Yeah, very, very good, you know, kind of rubric to live by. But again, you know, that gets that does not fit the narrative in mainstream medicine.
No, it's not profit driving. You know, it's so interesting what you said about the food environment as well being a downstream of the information environment, because I'm reminded of, I saw a picture the other day of like a diner from the 1910s, and it was like steak, steak and eggs, liver. Like you just go all the way down. And I was thinking about that. Literally every single thing that you could buy was an animal product derived dish. But if you go to the Cheesecake Factory and you open up that menu, what percentage of those dishes are animal derived? 5%, 10%, maybe, right? If you look, there's like desserts and all kinds of stuff, right? And that overwhelming of choice, right? And the reason why that happens, I believe, is because it's much more profitable to have all those other objects on the menu, right? And so then there's a profit incentive. And to your point, right, the healthcare system is a reactive to dealing with sick people, right? So it's like, okay, we have people that are sick. Why are they sick? Okay, we went one level up why they're sick. Let's go and attack that thing so they don't have the catastrophic failure. And what you're basically saying is by, eating whole, dense, nutritious food, by looking at what people used to eat, what we used to know, we're trying to shift to being proactive. So we're not responding to somebody who's unhealthy by saying, okay, make these interventions like I did. What we're saying is do these things and you'll remain healthy, and then you won't have all of these issues, or if you have them, they'll be lessened, basically. And that I'm very interested in as well, because I don't see there being as much profit in a proactive healthcare system as there is in a reactive. And so I'm kind of interested in what does that mean? Like, are you, like, is anyone actually going to hear you?
Well, and that is the challenge, I guess, the beauty, the good side of the internet, I guess, is that, we do have a chance to hear these, hear from people who we wouldn't, in the past have had a chance to interact with. It's also the downside of the internet. But it does give us a vehicle for getting information out there. And then, like everything else, building the networks becomes very important. And, I have the ability, both online, but in person as well, to network with like-minded physicians, other people involved in the healthcare system, and the people, the patients who have, woken up to this, who have, started to consume this information as well. And they are empowered to start to speak up. So it really does become that sort of ground up, that groundswell movement that can really start to affect change. Because again, we have to be practical, and we have to realize that, markets and money and profits have a role in all of this. And so if people start demanding these changes, the market's going to start to respond to that ultimately. And that becomes part of the solution then.
That's great. All right. We're going to get to the last comment. I'm going to give you the last word. To summarize what I think that you just said in a much, for me, is that we're not alone. Right? Is that a lot of us will come across this information that's really against all of the mainstream advice. And we start to take, like Phil did, the first steps, and it works for us. And now we're like, we want to tell everybody, hey, you got to go gluten-free. Oh, I'm not celiac, right? And it doesn't really translate. But I think the point ultimately that you were making is that we're not alone, and it's not hopeless, because there are people who are gathering on the internet, and it's getting better every day. And sort of the last thing that I would say is I read a statistic like this, and I don't know if it's true, but anecdotally in my own life, it's true, which is we see in the world that the number of obese people is increasing every single year. But we also see that the people that are fit is increasing every single year. It's like the middle is being wiped out and people are going to the extremes. And actually, at least what I read, is that there are more fit people today in their level of fitness than there have ever been in all of human history, which kind of makes sense when you think about the access to information and all the great food that you can get if you choose to. And sort of gets back into your point, is that there is a market for this and people are moving for it. But yeah, like that I find very hopeful and very positive. Okay, Dr. Phil, last word. Thank you so much for coming on the Information Diet podcast. Really appreciate having you here today. And final thing that you'd like to say to everyone.
Yeah, I mean, I think probably the biggest summary point is that you need to get intentional about your health. This is not something that you can be passive about. And so you need to, seek out the information that's going to get you there. But the first step is wanting it and becoming intentional about it. And then I think that will lead you down the right path.
Great. I like it. Be intentional in everything you do. Thank you, Dr. Phil, again. We'll see everyone next